actions to help fight the COVID-19 outbreak, and one of the steps announced by the governor was keeping the number of people in a restaurant to 50%.
Team 12's Michael Doudna joins us now. And Michael, there were guidelines to reduce capacity before, so what difference does this make?
Before, it was just a recommendation to reduce capacity, but come Saturday, it becomes a requirement. Reduce capacity to under 50% or risk getting shut down.
We have had a brutal June in Arizona.
Sky-high positive cases, hospital beds filling up, and long lines for tests has Governor Ducey rolling out plans to fight back.
And I know that there are differing opinions out there.
The headline of the governor's plan, restaurants will now be required to be at less than 50% capacity or risk getting shut down by police or a health inspector. And this could require potential changes from restaurants, like Joe's Diner.
Well, it's a challenge, but it's better than being closed down.
For Joe, 2020 has seen his restaurant forced to go to takeout only, then reopening his dining room only to potentially reduce the number of customers again.
Is it taxing? Yes. I'm exhausted. But is it possible? Yes. And that's what we have to go with.
But for former Arizona Health Director Will Humble, he says it's the other part of the governor's plan that may have a bigger impact. What the governor called Operation Catapult, which would increase the number of tests per day to 35,000 while reducing the wait time needed to get those results.
Because that will make a huge difference, probably a bigger difference than getting 100% compliance with the 50% limitation on restaurants.
Humble says better testing will make contact tracing more effective, but he says all of these steps are just part of a larger whole, because without a vaccine, it takes everything working together to help reduce the spread of the virus.
Those are all layers that work, you know, but they're not silver bullets.
The governor's order is set to go into effect on Saturday at 10 p.m. And remember, it would be county health officials or local law enforcement that would be needed to enforce the order. More in Phoenix, Michael Doudna,